Can D-Cycloserine help with PTSD? Can D-Cycloserine help with post-traumatic stress disorder? D-Cycloserine, often referred to as DCS, is an antibiotic that has caught the attention of researchers for its potential role in treating PTSD. The idea is that DCS might enhance the effects of exposure-based therapies, like cognitive behavioral therapy, which are commonly used to help individuals process traumatic experiences. DCS works by acting on a specific receptor in the brain known as the NMDA receptor. This receptor is important for learning and memory, particularly in the context of reducing fear responses. This mechanism is crucial for those undergoing therapy for PTSD, as it may help them better confront and process their fears. Research on DCS has produced mixed but interesting results. Some clinical trials suggest that when DCS is combined with exposure therapy, it can lead to greater improvements in PTSD symptoms compared to exposure therapy alone. For instance, one study highlighted that patients who received virtual reality exposure therapy, along with DCS, had higher remission rates than those who received a placebo. Specifically, 46% of patients showed improvement right after treatment, and 69% maintained that improvement 6 months later. In contrast, only 8% of those on placebo showed similar results immediately after treatment, with just 17% maintaining that improvement after 6 months. However, not all studies have shown consistent benefits. Some trials found that while DCS did improve symptoms, the differences between those taking DCS and those on placebo were not always significant at every follow-up point. This suggests that while DCS may have some positive effects, the extent of these benefits can vary based on specific treatment conditions. Ongoing research is still exploring how DCS can best be used alongside cognitive behavioral therapy for PTSD. Scientists are looking into the best dosages, timing, and which patient groups might benefit the most from this treatment. It is crucial to understand that DCS is not a standalone treatment for PTSD. It should only be used under the guidance of a qualified healthcare professional and as part of a broader treatment plan. Current evidence supports its use as an addition to exposure-based therapies rather than as a replacement for established treatments. From the perspective of PTSD, DCS has potential because it may help facilitate the learning processes necessary to lessen fear and trauma-related symptoms during therapy. However, more research is needed to confirm long-term benefits and safety. In summary, D-Cycloserine shows promise in enhancing exposure therapy for PTSD, but it is not yet a universally accepted or primary treatment option. If you or someone you know is dealing with PTSD, it is essential to consult with a mental health professional to find the best evidence-based treatment tailored to individual needs.